was a $630 million project. It was in 2 stages. So it was a redevelopment of 370 beds over 6 floors. And that was stage 1, and stage 2 was a multi-storey car park and a helipad on top of that, so which was pretty impressive. So all completed on time, on budget. Last completion was the 26th of June this year, and stage 1 was completed on the 24th of January 2017. Look, there was a lot of consultation, so it started way back 2009 is when it first started, so it's nearly a 10-year journey. There was lots of community consultation with the local politicians about getting a new hospital. So once we went to design, the partners were picked and the construction people. So it was with Exemplar Health, it was a public-private partnership. And they commenced community forums, which we were involved in, and we also organised. And the key stakeholders for us were, one, our community, 2 was our staff, because they're very important, and the other people was about the other businesses within the town. So we had an extensive program about trying to engage those people and also come up with a design and schematic design of what it would look like. So it's what we call a high-tech hospital. So we've got things like patient entertainment systems, which is controlled from their TVs to their meals to their calling the nurse, those sorts of things. We've also got what we call workflow terminals in each of the rooms, which have various layers on them, and that's from calling a code, code blue or code grey, right through to getting the porter to come up and move a item of furniture. So that's all done electronically. All our equipment is what we call HL7 compatible, which is able to talk to our EMR, which is electronic medical record ability. So it's all connected in via wires and data points and all those sorts of things. So every room has a data point in it. Some rooms have more than one data point. All the equipment is all connected, so the doctors can pull up any of the data around observations of the patients and those sorts of things. So far better than the old hospital. We didn't have any of those sorts of things except in our emergency department and our ICU. We've now got it through the whole hospital. So that process we did probably didn't have quite enough time to do it justice because it's fairly new to people. So prior to our commercial acceptance, we had 3 months of introduction people to the new technology. So mainly for the large workforce, which is the nursing workforce, is that they carry SpectraLinks, which are like a phone who you can actually talk to the patient. You can also dial up for the porter, those sorts of things. So we needed to be able to show the people how to log on, what do you do with it when someone rings you, how do you call a code, all those sorts of things. So we took a whole lot of staff, we actually allocated them to the units in which they are currently working in the new hospital, and we stepped through the process of this new technology for them and what they could do in each room. So it's more about the space itself. So technology we have, it's there. So we've got future-proofing nearly a whole floor of units, basically, which have the technology within them. It's just a matter of putting the infrastructure around it. So, for example, our patient entertainment system is not on those 3 new wards that we've got vacant at the moment. So we'll have to install that, but the actual smarts behind it are there. It's really just a matter of plug and play, as we would say. It's not a matter of rebuilding something to try and get it to work in the other units. So the actual technology within the building is all is in place, and the infrastructure for it's in place in the background as well. So, and we have capacity. So we've built in capacity within our system to be able to do that. I think the main thing is about hearing what other people are doing and how they went about it. And from my point of view is that we've already done it, so we've been there. So I hope, which I did today, is pass on that valuable information that you have from people going forward. Because there seems to be a fair bit of money going around for health, which is good, which is always a good thing. And look, in Victoria, most of our hospitals are in need of refurb or rebuild because infrastructure outdates itself pretty quickly. And in Bendigo's case, our hospital was built in 1960 was when it was built. So it's 40 odd years ago, and now we're finally getting a new hospital, and that'd be the most around anyway. So these sorts of forums are very good for people who are going into a new build